Good afternoon, everyone. We are Hands in Unity, your biggest advocacy group for vulnerable families in the Caribbean. We trust that you will enjoy our presentation today and participate actively with us. Allow me to now introduce the members of our advocacy group. First, we have Maureen Leslie Adamson, Crystal Blackman, Donna Jacobs Grisia. Then we have Kristen Jofield, Louise Roberts, also Trisha Townsend, Julianne McKenzie, and Corinne Cooper. The hard work of all these members make the things we do possible. Here are some pictures of some of the work we did throughout the region. We thank all our sponsors, our partners, and our volunteers for helping us with these initiatives.
Hi, my name is Maureen, and I'll be presenting the objectives. The objectives are identify key concepts, explain the importance of interagency relationships, and evaluate case studies. Thank you.
Our core values. We work together to support vulnerable families and ensure coordinated care. We respect family, diversity, and value partner agency expertise. We build trust by protecting privacy and being honest. We show empathy and kindness, offering non judgmental support to vulnerable families.
Vulnerable families in the Caribbean faces interconnected issues like poverty, unemployment, abuse, and limited access to basic services. To effectively address these challenges, collaboration among government agencies, NGOs, and community organizations is essential for providing integrated family-centered support. Interagency collaboration promotes shared values such as empathy, trust, and accountability while reducing service duplication and increasing efficiency. It enhances access to resources, enables early intervention, and helps strengthens family resilience and long-term stability in the region. Interagency collaboration is vital because it brings together different organizations such as education, health, and social services to provide holistic support for families by sharing resources like funding, staff, and data. Agency can deliver more comprehensive service without duplicating efforts. This coordination ensures that family service receive efficient target help through streamlined referral. Moreover, when agency unites, they create a strong collective voice to advocate for better policy and system. Overall, collaboration strengthens services delivery, improves outcome for vulnerable families, and promote lasting community well-being.
Study shows how integrated services can improve the lives of vulnerable families in the Caribbean. Ms. Brown, a single mother of three children, ages 3, 7, and 10, from rural St. Mary, Jamaica, was struggling with unemployment, poverty, and poor housing conditions. A concerned neighbor reported the situation to the Child Protection and Family Services Agency, CPFSA, which identifies the family as being at risk. The CPFSA coordinated help from several agencies. The Ministry of Education provided academic support for the children. Community health clinics offer physical and mental health care, and social services provided financial aid, parenting support, and job training for Miss Brown. Through this training, she learned new skills that help her gain employment and better provide for her children. This picture shows how different services work together to support the family. At the center is the family with arrows pointing to key areas of assistance: education, health, social support, and employment. Together, these areas provide holistic care that strengthens family stability, promotes well-being, and support long-term development.
Families who require support services are often least likely to access them. Collaborative partnership between agencies make it easier for family to engage with the resources that they need. For example, an indigenous family may be more willing to use the health service if it operates in collaboration with an indigenous organization. In cases where these particular services, such as parenting intervention, are stigmatized within the community, interagencies collaboration can reduce barriers by delivering these programs in the setting where they are more widely accepted. All right. For instance, a stigmatized program may be offered within a school or a child health clinic environment where family already feel trust and comfortable accessing. Thank you.
An example of how interagency relationships support vulnerable families in the Caribbean can be seen in countries such as Jamaica, Antigua, and St. Lucia. A parenting intervention was delivered through primary routine health services instead of asking families to come into separate programs. The health workers in the community, along with child development specialists, collaborated with local health centers to integrate parenting education into regular baby visits. Mothers attending for immunizations or checkups were shown short films and participated in guided discussion. Since this program was embedded in a familiar and trusted setting, families were more likely to participate. Research showed that children whose mothers took part displayed greater cognitive development. This case demonstrates how interagency collaboration builds trust and ensures that vulnerable families can access essential support in ways that fit naturally into their daily lives. Here are some pictures showcasing this initiative.
Early identification and intervention are important in preventing the intensifying risk factors in vulnerable families. With early recognition of developmental delays, behavior issues, or social risks across sectors, the professionals can provide timely support that improves future outcomes. ASHA 2021 coined that early intervention helps children achieve important milestones and life skills right from the start. It also helps families support their child's development and growth. One advantage of early identification and intervention is the prevention of escalation. When issues are identified early, practitioners are able to intervene to help reduce potentially long-term negative effects. This leads to better outcomes for families. Effective early identification and intervention require resources and collaborative actions by a variety of agencies. This allows for intervention that targets the family's needs. Interagency relationships are paramount in facilitating the collaborative approach.
Case study focuses on a group of young mothers in Trinidad and Tobago between the ages of 20 and 25, each raising two or more children. These mothers faced financial struggles, limited support, and emotional stress, which affected their children's growth and school participation. Together, several agencies worked together. The Ministry of Social Development offered grants and parenting workshops. ECCE centers supported the children's learning. The Ministry of Health provided health checkups and counseling, while NGOs like Families in Action gave emotional support and skills training. Community and faith based groups added mentorship and small business opportunities. After months of teamwork, these mothers became more confident. Some even started small businesses, and their children attendance and behavior improved. This case study shows when agencies collaborate, families become stronger and children thrive. It truly takes a village to. Here are some pictures showcasing our case study.
Agency relationships help families by bringing different agencies together to work as one strong team. When agencies advocate collectively, they can speak with one powerful voice to make sure families' needs and opinions are heard in decisions that affect them. This gives families more confidence and help them feel included, not ignored. Through coordinated efforts, agencies can share information, avoid duplication, and provide full support covering health, education, housing, and emotional care. Working together also helps build family resilience, giving them the strength to face challenges while reducing the stigma that comes while seeking help. In simple terms, interagency collaboration means families are not alone. Many hands are working together to protect, support, and empower them.
A case study, interagency support for Leah, a single mother in Jamaica. So Leah is a 24-year-old single mother living in St. Thomas, Jamaica, who gave birth to her daughter at the age of 19. So with little family support, Leah's mother is overseas and she have an absentee father. She struggles with a lot, such as unstable housing, unemployment, and postnatal depression affecting the care of Tia. So a community health aide noticed Leah's distress and Tia's irregular clinic visit, referring them to the CPFSA. So social workers assess the situation and identify Dia's need for support to improve her parenting and well-being. So several agents collaborated to address Leah's needs. So the school, Tia Preschool, monitor her daily and provide feeding programs. Healthcare, the local health clinic in Morantby provided regular postnatal depression, pediatric and mental health care and counseling services. NGO, the Woman Empowerment for Change in Jamaica offered parenting workshops and group therapy. Child and welfare officers coordinated home visits, monitored the child's safety, and connected Leah and Tia to necessary resources. So the community development officers, in partnership with the Food for the Poor, provided Tia with secure housing. So Leah's outcome, right? So since she collaborated with the different agencies, she was able to stabilize her living situation and provided mental and emotional health support. So these pictures depicts collaboration between different stakeholders, both governmental and NGOs, which they are showcasing the aid that they provide to the public.
Does anyone have any questions?
Interagency cooperation unites social, health, and education sector to provide comprehensive support for at-risk Caribbean family, improving stability, reducing duplication, and promoting dignity through accessible community programs. Early detection and intervention help agency prevent problems and build stronger communities, while collaboration based on trust and respect ensures equitable, holistic support for all Caribbean families and children.
This is the end of our presentation, and I would like to say a big thank you to our stakeholders and also our collaborative team that came together to present. And I would like to say, I hope that you find the information very informative. Thank you.